So, very fresh. Good evening, everyone. I'm audible. Please mention in the chat box. Yes, thank you. Okay, so time is already on. So let's start it. So namaste. With the great excitement and gratitude, we welcome you all to today's session. I, Dr. Dipali, extend a heartfelt welcome on behalf of Ayush Gurukulam and Zenith Ayurveda. Ayush Gurukulam is not merely an organization, but a thoughtful initiative born from the vision of busy scholars and BMS students who wish to justice to our great science and uphold the world of Apta Updesha. So, in collaboration with Zenith Ayurveda, we aim to create a platform where knowledge and practice meets, helping Ayurveda reach new horizons. So, we firmly believe that nothing is possible without strong fundamental knowledge. Knowledge has the power to create new ways of thinking, new perspective, and new paths for the future. With this spirit, we decide to begin this knowledge sharing session decided exclusively for you. As it is often said, you haven't chose Ayurveda. Ayurveda has chosen you. So let's us all make Ayurveda proud through our effective collective efforts and dedication. So we deeply thankful to our mentors and participants who are the true saint of this initiative. With that, I now hand over the session to Dr. Sri Priya. Thank you. So please, Dr. Sri Priya, you can start. Uh, your mic is mute. Yes, Dr. Sri Priya, is there any issue? Just a minute. I'm unmuting. Just a minute. Yes, you can start now.
Okay, sorry for the delay, everyone. Good evening, everyone. I'm Dr. Sri Priya from team Ayush Gurukulam and Zenith Ayurveda. It is my absolute pleasure and a great privilege to introduce you to our today's guest, Dr. Ashwin K Sir. Sir belongs to Kasargod district, Kerala. Sir has completed his BMS from prestigious Ayurveda Mahavidyalaya, Hubli, and has pursued his PG degree in Rachna Sharia from the same institute. Dr. Ashwin Sir is currently working as assistant professor at the Department of, sorry about that, at the Department of PG Studies in Rachna Sharira at Ayurveda Mahavidyalaya, Hubli. Sir has innumerable laurels to his name and is an active practitioner with almost 8 years of experience in Agnikarma, Viddha Karma, Kshara Karma, and Rakta Mokshana, etc. Ashwin Sir has been awarded Global Star Award as Best Emerging Medical Professional in Karnataka for successfully managing cases of high creatine with Viddha Karma. Apart from publishing papers in various international journals, Sir is also a reviewer in 4 international journals of Ayurveda. Sir regularly attends various CMEs across Karnataka as a resource person delivering high impact clinical trials and workshops, hands on training sessions, etc. on Agnikarma and Viddha Karma. Apart from being an attendee in over 20 seminars and conferences. Sir is also very proficient and well versed in several Indian languages such as Hindi, Kannada, Tamil, Telugu, Marathi, Konkani, etc. Ashwin Sir is a very skilled academician, a proficient clinician, and gifted researcher. It's our absolute honor to host such a distinguished and accomplished Vaidya for a clinical lecture. We extend our gratitude to Dr. Ashwin Sir and we thank him for freeing his schedule and accepting our request to join this session. I would like to now request Dr. Ashwin Sir to take over the session to share his valuable knowledge and insights. Over to you, sir.
Thank you so much. Good evening, everyone. Am I audible? I think I am audible, and even my screen is visible, right?
Oh, screen is not visible. Yes, it is visible now.
Visible, right?
Yes, yes, it
Shall
is
we
visible.
begin?
Yes, sir, we can.
Okay, sir.
So, are you excited for your today's session? Agnikarma and Viddha Karma. So, before starting with the session, so let it take it as an interaction session. What do you know about this Agnikarma and Viddha Karma? I think all the practitioners, students, and professors, everyone are here. How many students are here? Can you just type in the chat box? Students, practitioners, how many of you are already practicing Agnikarma and Viddha Karma? Yes, students, PG scholars. Yes, I think most of you are students and PG scholars. So we'll continue accordingly. We'll deal with the basic things. Yes, almost all are students, I guess. Okay, can you say what is Agnikarma and Viddha Karma by the name itself? What you can make it by the name Agnikarma and Viddha Karma? Yes, by the name itself, you can say Agni means fire, right? And Karma means the work. So the thing which we do in the with the help of Agni, with the fire. So the treatment which we have to do with the help of Agni, that is can be called as Agni Karma. In simple words, we can explain, right? And Viddha Karma, how can you explain it? Viddha Karma. So Viddha means puncturing. So puncturing with a small needle, it can be called as Viddha Karma. The work we do with the help of small needles. So that's what called as Viddha Karma. So before going to the topic, just imagine a patient comes to you, or you would have someone of you would have experienced like kidney stone pain or renal calculi pain. So there it will be like a severe pain. Even if you go to the modern doctors, they will be giving some injections or IV or anything, IM, and still the person will be suffering pain, and it will take more time for recover from the pain. So you will be taking just a small needle and you will be giving a small prick in some part of your body, and magic happens. Suddenly the pain vanishes. So how will be your reaction and also your patient's reaction? Yes, they will be surprised, right? Even the modern people, modern medicine can't do such magics or miracles, but with a small needle, we can do everything. So that is nothing but that is Ayurveda. So now can we say whether Ayurveda is low? Do you think still Ayurveda is low? Yes, that is nothing but with the help of Viddha Karma. With the help of Viddha Karma, we can do so many miracles. So usually Ayurveda means people will be thinking about Panchkarma. So if Panchkarma is the crown of Ayurveda, the jewels which is inside the crown, it is Agnikarma and Viddha Karma. So we will deal with the Agnikarma and Viddha Karma today. So what do you mean by Agnikarma and Viddha Karma? How it is done? Can anyone explain? You can on your video and you can explain, or you can unmute your voice and you can explain if you want. Any students? Anyone? Okay, no worries. We'll deal with that. So coming to Agnikarma. So how it is done is we will be with the help of fire, as he said already. With the help of fire, we will be doing the treatment. That is Agnikarma. So there will be many instruments. What are the instruments used for the Agnikarma? So they are called as shalakas. We usually use shalakas, and we use some Buddha and Sneha Agnikarma, all those things with the Madhu, all those things. So I'm visible, right?
Yes, sir.
Yes. Okay. So this is called as shalaka. Can you see this? Yes. Yes. This is called as shalaka. There are different types of shalakas. Here, different types of shalakas. Visible, right? So these are the different types of shalakas we use. So there are like Mritika Shalaka. This is Mritika Shalaka, and this is Suvarna or Suvarna Varna Shalaka. And the smallest Shalaka we use for the cosmetic purpose. We call it as a cosmetic purpose. And these are made up of different instruments, different metals like Panchaloha, Panchadhatu, or Loha, or silver, gold, all those things. So they will be using these things according to the condition, different conditions. So we are dealing with the basic things. We will not focus on the which metal we need to use. So we'll first of all, for Agnikarma, we can use any type of metal. If you don't have any shalaka, you can use any metal, whichever you are getting. For example, if you are in a kitchen, if you are getting a spoon, you can do the Agnikarma even with the spoon. No need of getting surprised. Yes, we can do with the any type of metal. If you have any small rod of metal, we can do the Agnikarma even with that. So the materials doesn't actually matter. We can do the procedure in any type of metals or anything by heating that. So there will be criteria like for which condition which metal should be used. But for basic things, we can use any metal. No need of worrying with that. So that's all about the Agni Karma. And coming to Viddha Karma, can anyone say what is Viddha Karma? Yes, we'll be doing it with the help of the needles. Okay, there are different types of needles. So usually we will be using 26 into half needle. Is visible? Is 26 into half needle. So we'll be using this needle. This is a 26 into half needle. So that is the length of the needle we usually use. And one more needle. This is 26 into 1.5. Okay. So same diameter, but length varies. I will tell you exactly where we will be using 26 and a half and 26 into 1.5. So what we will be doing with this needle? So we will be taking this needle and we will be pricking in some part of our body. So selection of the part of the body will be discussed later. We'll show some videos and all. We can discuss it later. So that is the procedure of the Viddha Karma. We'll be taking the needle and we will be pricking the needle in some part of the body. So we can select according to marma points or whether according to the tenderness point, all those things. So that is all about the 26 into half needle. That is the size. So in Ayurveda, if you want to say, it is the one brihi. The length of the needle is one brihi. So how much we need to prick in the side? So it is also according to the marma point. So first of all, while learning the Viddha Karma, main thing we need to understand is marma points. We should be perfect with the marma points. Marma points should be very perfect. So because what is marma? Mara entity marmani. That means if we injure the marma according to its type of marma, it will injure us also. That is, if it is Sadyopranara marma, it can cause death also, and if it is Rujakara, it can cause pain and it can make the make paralysis, all those things. So in any condition, we should not hurt the marma. So accordingly, we will be pricking the needle on our body, okay, on patient's body. So that is in some places, if the marma point is deep inside, that's why I said the marma knowledge of marma is very important. For example, if you see here, which marma is here? Can you comment down? Which marma is present here? Angushta Anguli Madhye.
Shukra, Shukra Marma.
Yes, very good. That is Shipra Marma. It is present in between the Angushta and Anguli. That is Shipra Marma. So if you know where exactly it is present, that is how much deep it is present, we can prick here. So that is why marma knowledge is very important. So if you are pricking deep inside, this total length is 1 vrihi. So in some position, marma will be superficially present. So in that cases, we need to prick superficially. That is, in some places we need to prick half vrihi, some places 1/4 vrihi. In some places, if the marma is not situated in the particular place, we can prick complete one needle. That is one complete vrihi. Vrihi means the length of the needle. Okay, that is about the Viddha Karma. Now coming to the combination of both Agnikarma and Viddha Karma. So how it is done? It is called as Viddha Agnikarma. That is, we will be doing Viddha and also we will be doing the Agnikarma. That is, with the help of, in this case, we will not be using one Vrihi needle. Instead, we will be using 1.5 Vrihi needle. In that cases, we will be using both needle and also fire with the Agni. Means we will be piercing and also we will be giving Agni. That is, we will be, after piercing, we will be, for example, if you pierce half ray of the needle and remaining one part of the needle will be left outside the skin. So what we will do, we will be burning the needle. Like this, we will be burning the needle. Right? So that is how we will be doing. Right? So that is called as Viddha Agni Karma. So is that clear? Agni Karma, Viddha Karma and Viddha Agni Karma? Yes. So next, we will be getting some doubts or questions from the patient. Is acupuncture is similar to Viddha Karma, right? So is there any difference between Viddha Karma and Agni Karma? Agni Karma and Viddha Karma and acupuncture. Is there any difference? Yes, there is. This completely different. Both are completely different. If you go, the Viddha Karma comes from Ayurveda, that is Indian origin, but acupuncture we can say it as it is a Chinese origin. So Viddha Karma, it acts on the Vata or according to Marma points. So there will be vitiated Vata in our body. So what it does, this mechanism is, if the we will be doing this for the pain treatment. Usually, for the, if we take the example of pain treatment, for example, any Katishula or Sandishula, anything. we will be doing this with the karma for the treatment of pain. So how pain occurs? So according to Ayurveda, it is due to the vitiated vata, right? So Acharya Sushruta already said that pain, that is shula, nasti shulaha vina vataha, that is without any vitiated vata, there will not be any pain. So there will be vitiated vata in particular place that causes the pain in our body. So what we do is we will be removing that vitiated vata from our body. So that is with the karma. So as I already said, we'll be using the needle. So needle will be hollow. It will not be completely. It is not a complete needle. It is a hollow needle, right? Injection needle. You can call it the insulin needle, the smallest insulin needle. So it will be hollow. But in case of acupuncture, it is not the hollow needle. It is the complete needle. It will not be hollow. So what this Viddha Karma does is it will be removing while pricking. It will be removing out the vitiated vata from the body, which it will be removing the vitiated vata, and thus the pain will be vanished. That's how the Viddha karma works. But in case of acupuncture, it is not similar. It acts on the meridian. According to Chinese studies, there are some meridians in our body. So they will be pricking according to their meridian. There are many axes and all. According to acupuncture, they will be pricking according in the exact point of the meridian. But we, in case of Viddha karma, will not be doing according to meridian. It is on the marble points or tenderness points, similar like that. So that is the difference between Agnikarma and Viddha karma, right? So is that clear? Any doubts in Agnikarma and Viddha karma before going to the procedure? Yes, I guess it is clear. So coming to indications. So can you tell me which all conditions we can indicate the Agnikarma and Viddha karma? Can you just comment in the comment box, chat box? In which all condition we can use Agnikarma as food pain, Vata Kantaka, very good. Vata Dosha, Sciatica, very good. Corn, sorry, what was that? What was the comment about Sadhya Pranaramarma? I couldn't read. Yes, sinusitis, frozen shoulder. Yes, regarding question, we will keep the question and answer session the last. Sirashula, yes, yes, many other things. Neuromuscular, spine, arthrological, Sirashula, jugular vein with the karma in migraine. Yes, it can be called as Siraveda instead of migraine. It's somewhat similar. Yes, yes, right. These are the indications where we can do Agnikarma. So, in which cases, in which all conditions we can, it is contraindicated? I already said about indication. What about contraindication? Is there any contraindication of Agnikarma? Pitta Vikara. Okay. In Varsha Rutu. In Grishma Ritu, it is said to be contraindicated, but not exactly. If it is mandatory, if it is needed for the time, we can do even in all the Rutus. There is no contraindication according to Rutu. We can do in all the seasons. But in case of pregnancy, we can avoid. And if the person is taking blood thinners, then we can avoid with the karma. So that because there will be more bleeding, yes, bleeding disorders, very good. Yes, in such conditions we can avoid with the karma and Agni karma. Madhumeha we can do it, no problem. No worries in Madhumeha, we can do it. There is no any problem with Madhumeha. Recently I am doing a trial on Madhumeha one. I am working on a with the karma. Uh, I'll show you later. We'll discuss about it later. Okay. So we'll see some cases. So indication and contraindication. So what you can see in this image, can you diagnose this, the first image, before image? before image? Can you comment in the chat box the diagnosis? Not leprosy. You can see the hand is deviated to the medial side. Radial nerve injury, wrist stroke. Yes. Paralysis, swan neck deformity. Yes, it is somewhat related to nerve, right? Yes. So in this case, the patient came to my clinic with this condition. So I just did a Viddha Karma within one sitting of Viddha Karma, and just within few minutes we can see the result in the next image, after image. It is here the ulnar nerve was injured, and soon after the Viddha Karma, the hand was proper. So that is the result of Viddha Karma. So now can you say the Ayurveda is slow? Can a modern people can do this such miracles within seconds? Yes. Yes. And this is our next indication. So you can see this skin tag in the first image, and this is soon after the Agnikarma. We can see the result of after Agnikarma. So here the hot shalaka was so this type of shalaka can be used. We can see here with this point we can be just cutting this skin tag. We will be heating and we will be heating the removing the skin tag. So if you go to a modern hospital, what all things we need to do? We need to do all the blood investigation. After going through a small surgical procedure, we need to do the bandage. Then after that, we need to take all the tablets. Then regularly we need to take the bandage. All those things. But in case of Agnikarma, there is nothing. Just remove the tag and just go to do the home and do your regular activity. That's the beauty of Ayurveda or Agnikarma. So here, this is the indication of, here you can see the indirect Agnikarma. You can say it as indirect Agnikarma. Why we call it as indirect Agnikarma? Why not Agnikarma? Even here we are using fire. You can see we are using fire here. But why not it is called as direct Agnikarma? This conduction method. We don't directly apply Agni on it. Yes, correct. So in such this is the case of sinusitis. So in such condition where we can use such indirect type of Agnikarma, yes, for in cosmetic purpose, if we take the red hot shalaka and if we burn, then what will happen? There will be marks or the face or anything. But in this case, we can avoid this marks. Yes, marks will be going. It will be vanishing within 2 or 3 weeks. But still, there will not be marks with the help of indirect Agnikarma. Will not be using direct fire, direct red hot shalaka in this here. Will be indirectly hitting the shalaka. This is the case of sinusitis. Here, interesting case. What is the diagnosis? Can you say the diagnosis here? Yes, this is a case. Ulcer, not ulcer, stomatitis. No, no. Any other answers? Diagnosis? Yes, it is a mucosal cyst. It is already written and still you are not saying. It is mucocyst. It is called as mucocyst. What we call it in Ayurveda? Yes, we call it as Jalarbuda. Right? Yes, very good. Jalarbuda. Yes. So here in the first image, the small child was he had underwent surgery for this mucocyst. 15 days back, he had undergone the surgery and he had completely removed the cyst. And after 15 days, it again reappeared. There was recurrency of the Jalarbuda or mucus cyst. So he came to me and I did an Agnikarma for this. And till now, there was no recurrence. This happened in 10th October 2023. And till date, he is regularly visiting my clinic for other purpose, not for this Jalarbuda. And there was no any recurrence in the Jalarbuda or mucus cyst. You can see the result in just after 3 days in the second image. And even here is a cosmetic purpose. Here you can see in the first image there is a skin tag in the first image, and just soon after 2 days you cannot even see a mark in the face. So it was completely vanished. No bandage, no application, nothing. Only Agnikarma. And here, an interesting case of a child. Just observe the. I'll show the video. It is not playing actually. We'll show it later. Okay, this is the case of a small mark in the skin. So after the Agnikarma, you can see the result. And this is the case of anosmia. Remember anosmia? Loss of smell. So here Viddha Karma was performed. Sorry for the inconvenience. Yes, in this image, you can see the video is not playing actually. I will show it later. Again, I will show you. So in this image, you can see the old age person. He came to the clinic. 4 people carried him. He could not walk even with the stick. And I missed the first video. And in the second sitting of Agnikarma and Viddha Karma, he started walking with the stick. So here you can see.
Sir,
So
I'm
the first
presenting.
video. Sorry.
I'm presenting the video.
Okay, okay. Displaying there. This one. Where it is playing. Previous. Previous one. Yes, this one. No issues. We'll play it later. So he was soon after the one sitting of Viddha Karma and Agnikarma. Just to look at his face, he is working with the stick. In the first sitting, he came with four people. And even he can sit without the help of any people or stick. You can see the happiness and security in his face. So in this case, you can see how his eyes was. Next, this patient came to me with the bleeding in his leg. So what we will do usually if there is bleeding? Can you comment down? Bleeding in his leg. Sandhana, yes. So I didn't do that. I just did the Agnikarma. You can see how I did. It is visible, right? So that's it. Done. 2 minutes work. When his bleeding stopped and his wound got cured. So this is after Agnikarma. You can see blood completely stopped and his wound was clear. There was no any requirement of bandage or anything. And here, this is a case of cyst, sebaceous cyst. You can see here. It is visible, right? Sebaceous cyst. This is a cyst. So what we can do in this condition, sebaceous cyst? Yes, we can do Agnikarma. Everywhere Agnikarma. Excision. Yes, even we can do excision with the help of Agnikarma. This is after the excision. No any blades used, only shalaka. Such shalaka. Such shalaka we can use. And this is after the removal. There is no need of any bandage or any antibiotics, nothing. Only Agnikarma. Everywhere Agnikarma. Yes. Here in this case, you can see this is a reading of a, in case of a short side. You can see here, this here you can see the date, that is 6th August 2023. And here you can see the power of the eye, that is left side eye, you can see minus 3.0, right? And here you can see 7 September 2023. That is exactly 1 month after the Viddha Karma. I have done the Agnikarma on 6th August 2023 after reading the noting the reading, and after exactly 1 month, 7 September 2023, I got the result. Just one sitting of Agnikarma, that is minus 2.75. Just one sitting of Agnikarma and decreased 0.25, minus 0.25 power. That is eyesight in case of short sight. Isn't this miracle? Can anyone, any modern medicine do such things? And is there any modern medicine for such a short sight other than specs? Not Agnikarma. Why we use Agnikarma in short sight? Not Agnikarma. It is Viddha Karma. We'll be using the needle. We'll be using the needle for this treatment with the karma. So there will be some points like here. I'll show it later. And here, this is a case. You can see this is the urine routine report that is as shown on 28/11/2023. And here you can see the reading. Plenty of pus cells and epithelial cells are 223. And it is before the Viddha Karma. And next you can see the date, that is 29/11/2023. That is just next day of the Viddha Karma, just next day after Viddha Karma. And you can see the result. That is from plenty of pus cell, it have reached to 4 to 5 pus cells. You can see, right? And epithelial cells, there was 2 to 3, and here it is occasional. So that is just within 1 day of Viddha Karma. No any internal medicine, no anything, no any other than Viddha Karma. Only one sitting of Viddha Karma. That's it. And here, in this case, in the first image you can see the lady was she could not. What was the question? At what side? Yeah, we will discuss it later. The lady couldn't. She couldn't eat properly. She couldn't take her hand up to her mouth. We'll show the video. Here you can see. She couldn't take her hands up to her mouth. It was very difficult for her to eat. She used to, others used to feed, or she used to take spoon. And after one sitting of Viddhakam and Agnikam, you can see one sitting of Viddhakarma, and this is after 15 days. So that is the case. And here, so this is of treatment of corn, removal of corn. So usual mistake we do while doing the corn treatment is, so we will be using anesthesia. Usually, even in the institutes, also they will be doing the same thing. That is, they will be using anesthesia, local anesthesia, in case of while removing the corn. But it is completely wrong. I will say it is completely wrong. So if you can explain it, see here. This is the skin area, normal skin area. So what happens in corn is, you can see like this. So So corn will be like this, right? Will be in the shape of a cone. This is below the skin. So these are all the, sorry. So this is the layer of the skin, superficial layer, and here this is the corn, how it is developed. So what is our aim is, with the help of this shalaka, you can see the shalaka, right? This pointed end, this shalaka. Our aim is, we need to bring the shalaka here, right? We need to bring the shalaka, heated shalaka here, and we need to completely burn this tissue. That is, it is dead skin. This what you are seeing in the red color. It is the dead skin. So we need to completely remove the dead skin with the help of red hot shalaka. So what usually people do is they will be giving here local anesthesia, right? So what will happen is there can be chances of complications if you give the local anesthesia. So if you give local anesthesia in this area, so what will happen? The complete site will be anesthetized. So we cannot feel anything. So if you burn from here, if you start burning from here, you will be burning, and in some cases, what will happen? You will be burning only this much area. Other dead skin will be left over. So what will happen? The corn will reoccur. This is the one case. And in some other case, what will happen? You will be burning the corn and you will be exercising completely. You will be burning more. You will be doing atidagda. That means you will be burning the most of the good skin also, good tissue also. So that will also cause the wound. Okay. So that is the complication that can happen if you give local anesthesia. But usually we should never give local anesthesia in case of corn. I'll draw it again here, normal skin. The tissue. Our aim is to burn this. Our aim is to burn the dead skin. So if you, so this will be dead skin, sorry. Our aim is to burn the complete tissue. So if you burn the this without giving anesthesia, here there will be no any pain in this area. In this area, if you burn with the red hot shalaka, there will not be any pain to the patient. So when the shalaka reaches to the normal skin, the patient will be getting the pain. So that we can easily identify where exactly to burn and when to stop the burning. So that is why we should never use local anesthesia for the corn, burning of corn. See the next case. Yes, here you can see. So this is the case of CKD. The patient was just 23 years. He was just 23 years, and it happened in 2023. So he was continuously taking levocetirizine tablets and antihistamine from the on the counter. He didn't get any. He didn't go to any doctor for the some itching purpose. He used to take continuously daily levocetirizine tablet for complete 1 year. So what happened is he got the CKD. Due to this tablet, he got CKD, and he was undergoing dialysis in the age of 23 itself. In weekly 2 times, he used to go do dialysis. And his creatine reading, you can see here, it is almost 14.59, and it was 14.59 and 16, because like 14 to 16, 14, 16, 14, 15, 16, it never went down below 14 or 15 or 16. It was completely from since 1 year it was 14 to 16, even after the dialysis. And even he was taking oral medicine also, and later he came to me, and I performed with the karma in this condition. I already said him I will not be giving any oral medicine. I will be just doing Agnikarma, and alternatives you need to come with the new report. So he agreed, and while coming to my clinic, his creatine was 14.9, and he came to my clinic, and I performed the with the karma. And can you imagine what will be the report creatine level after 1 day of one sitting of Agnikarma? Sorry, with the karma. Can you type in the chat box? The creatine level was 14. and one sitting of and even after dialysis and all, and no any internal medicine given, only with the karma was performed, and within one day, yes, you can see the report here. It is miraculously 8 within one day of Agnikarma. No any internal medicine, nothing. The patient was completely shocked. That is the power of Ayurveda and Viddha Karma. Can you imagine this? The complete dialysis couldn't do this, and just a needle did the job. Just a needle did this job. That is 14 to 8, almost half it. No any internal medicine, only with the karma. So I think this is the procedure of burning the Musika Shalaka. So we need to burn like this till it becomes red hot. This case of calcaneal spur. The other video is missing actually. So with this burnt shalaka, we will be burning the, yes, here it is. We're keeping a paper and we will be burning the tenderness point. That is in the case of calcaneal spur. That's it. The pain will vanish within seconds. So I think the time is up. Actually, it is a very big topic. We cannot cover within 1 hour. So this is all about Agnikarma and Viddha Karma. So this is are not just the treatments. Agnikarma and Viddha Karma are not just the treatment. They are the symbol of Ayurveda's timeless wisdom. So let's practice, let us preserve and promote this science. Let's ignite the flame of Ayurveda. So uh, I hope everyone will practice it and will promote the Ayurveda and Agnikarma and as well as Viddha Karma. Uh, yes, there will be the people will not be getting results. Usually, what happens is after the with the karma or agni karma with the after doing the with the karma, after doing all these things, they will not be getting results, and they will be blaming the science. They will be like the karma won't work. वो काम नहीं करता है, ये काम नहीं करता है, अग्नि कर्म नहीं करे काम करता है. That is not the mistake of with the karma or agni karma. That is the problem with us. Even I didn't get the result at beginning. Later on, if you are doing it properly, the result will also you will be getting the proper result. So try, and you will succeed. So don't go back, don't step down. You could try it, and if you need any help anytime, you can contact me anywhere. So these are all the social media links. You can contact me anything related to Agni Karma or Viddha Karma. You can contact me anytime. Any doubts, anytime. I am here to help. So that's all about the session. If you have any questions to ask, you can question. I'm ready to answer.
So please everyone ask question regarding the session firstly.
Instead of chatting, you can just on the mic or you can on the camera and you can ask the questions.
Hello, sir. Namaste, sir.
Yeah, namaste.
Sir, thank you, sir. Session was too informative, sir. Sir, I have one doubt, sir.
Yeah, tell me.
That myopia case you have showed, right?
Yeah.
What was the site? Was it was between the Bru Madhya or this thing, sir?
Yeah,
Where was the
exactly.
site of
Here
Viddha
I
Karma,
want to
sir?
show you. Exactly here. This is the one point, and next one is near the hairline here, and next one was the Shankamarma. So it will be we should be very careful about this, though it is Sadyopranaramarma, and this one is very deadly murmurs. So we should be very careful. These are the 3 points I used: 1, 2, and 3 near the Shanka.
Sir, what was the second point, sir? One was Shankar Marma, sir, and another thing was Bru Madhya, another, sir, middle.
Yeah, we can see the hairline, right? This point you can see.
Sir.
Exactly.
Yeah, okay, sir. Thank you, sir.
Yes.
Good evening, sir.
Yes, good question. Where can we differentiate Agnikarma and Viddha Karma? Usually in the neurological cases, we can go with the Viddha Karma, and pain condition, we can go with the Agnikarma. And according to patient also, some will be scared. Some patient will be scared if you say we are burning you with the Shalaka. And in such cases, you can go with Viddha Karma.
Good evening, sir.
Good evening.
Sir, in lipoma cases, with the Agni Karma will help, sir?
Viddha won't work. We can do Agnikarma. Lipoma means we need to remove the mass, right? So we can take a excision with the help of Shalaka, such Shalaka, and with this we can give a cut. Then we can remove the lipoma outside, and we can burn the all tissues, surrounding tissues, so that there will not be bleeding.
Okay, sir. Thank you, sir.
Yes. Yes, diabetic condition. Can we do it in diabetic condition? Yeah, we can do it. Presently, I'm in a study, and I'm working on it. In there was a case in which HbA1c was around 12, and he had done some Viddha Karma, and after 1 month it came to 8. I not published it yet because the study is still going on.
Sir, there are some questions on YouTube as well.
Yeah, please.
So I'm forwarding. Ravi Kiran is asking on which area we have to perform in CKD.
CKD, yes, it is in the foot region, Angusta.
Okay.
Actually, we cannot tell this exactly. We can't show these things in the video because the point should be very precise. If you can come face to face, it will be very easy to learn as well.
Application of Agnikarma in sciatica.
Yes, we can do it. So what happens usually is in sciatica, the nerve will be sciatic nerve will be compressed in the lumbar region. So what we will do is we can do both indirect method as well as direct Agnikarma in the lumbar region. So we need to identify where exactly the nerve is compressed in between the lumbar vertebra, whether the disc have bulged, what had happened, and according to the site we can do the Agnikarma, and it can be cured completely.
Okay. One more question is coming again and again. Dr. Mosina is asking, will you conduct hands-on training on this?
Hands-on training, we have not thought about it, but if many are interested, we can think about it.
Yeah, sure.
It will be more useful as well because just by online session we can't perform all these things. If you see it directly or the hands-on training, we can. It will be more useful as well. How many are interested in hands-on training? Many are interested. If so, we can think about it.
We can have poll in chat box.
Sorry.
So just mention in the
One
post,
question, sir.
everyone.
How to decide the area of the Viddha Karma in various diseases?
Of which, sir?
In whatever disease, how to decide that okay, on this area we have to do Agnikarma or Viddha Karma?
Yes, it is according to the marma points. Like in which condition, for example, if we take the sciatica also, because sciatica happens in the lumbar region, so we can identify the region. So what happens usually is the nerve will be compressed in that area. So we need to give more blood supply to that area, so we can perform the with the karma in same site.
Hello, Namaste, sir.
And sir, one more doubt:
Yeah, okay.
how to choose the shalaka, or if we want to use the Varna shalaka or Dhatu shalaka?
Sorry.
How to choose the shalaka, or we want to use the Dhatu shalaka or
Yeah,
Varna
the
shalaka?
type of shalaka you need to use. Yeah, yeah. As we are explaining, basically, we can use any type of shalaka. But if you're perfect with that, according to the conditions, we can use it. Knowledge of the shalaka is not important, according to me. The type of shalaka, the type of metal used is not important. As I said before, we can use even the spoon which you are using for the eating purpose. We can use even that for the Agnikarma. Metal doesn't matter, because usually I use Loha Shalaka and I get a result in that, in all the conditions.
Namaste, sir.
Yeah.
Sir, as you said, sir, after doing Agni Karma in the corn, sir,
Yeah.
there will be peripheral hardness, sir.
Yeah, yeah.
That burnt, sir, what happened, what we have seen in the patient, after doing Agni Karma, sir, after 1 or 2 weeks,
Yeah.
the burnt hardened peripheral thing will be more painful, sir.
Yeah, yeah,
So we should scrap that after Agni Karma, or so what's your thought on that, sir?
no need of scrapping, it will come out. It will come out by itself and it will fall down. If the patient is feeling more pain, we can repeat the Agnikarma again. No need of scrapping it. It will go by itself after Agnikarma, after some days. If it is more painful, we can repeat the Agnikarma on the same side and we can burn it off again.
Right, sir. Thank you so much.
Yes.
Namaste, sir.
Namaste.
Sir, can you please tell what is the role of Viddha Karma or Agni Karma is fine, Viddha Karma in the Samprapti Vighatana of any of the diseases other than pain management?
Like it will be giving vascular supply, and it will be vata will be the vitiated vata. If you take the vata, vitiated vata will be removed, so that disease will be cured. That's it. In simple way, we need to explain.
So to add on to the question, do we have to see for lakshanas related to vata alone to decide if we have to do Viddha Karma, or any other dosha manifestations we can choose Viddha Karma?
No need of taking this doshas. I'm just explaining the things, what the mechanism I'm just explaining. Vata, in case of pitta, we can avoid it.
Okay, sir.
Yeah.
Thank you.
Namaste,
Sir,
sir.
whether this with the
Sir,
Yeah, tell me.
whether this Viddha Karma is disease management or it is just a pain management, sir?
It is disease management. We can manage the disease, we can cure the disease, we can cure the pain also. Pain is just a symptom. Pain is not a disease, right?
sir, which book is good to refer for Viddha Karma and Agni Karma? That too for selection of sites, sir.
Before selection of sites, what exactly we need to know is the marma point. So marma point is very important for Viddha Karma. So before learning that, we need to perfect with the anatomy and the marma points. So for marma, we can refer marma. There is a book Marma and its management. So you can refer that. So once you are perfect with the marma, then yourself you can do it.
Hello, good evening, sir.
Good evening.
How we have to decide that marma points on particular diseases, sir?
Yeah, that's what I said. If you are perfect with the marma, you'll get to know it because some marmas are related to some organs. In the and in case of CKD, we need to not only Angushta Mula, we need to perform it in the back side also. That is in the surface marking of the kidney.
Sir, in renal calculi, we do the Angustanguli with the karma, right, sir?
Yeah, yeah.
Whether does it only reduce the pain or this thing are related to stone, sir? And if it is all if it is all directed towards the stone management, sir, please
Yeah.
explain the mode of action, sir, if possible.
Yeah, it will, what it does is, it will do the vasodilation. So the stone which is present, it will be easily coming out. I am just checking the photo of that. There was a 12 stone, and after with the karma, within 2 days the stone came out.
Sir, vasodilation or it dilates this ureter thing or like that, sir?
Yeah, same thing. Vasodilation or the ureter also. That is the thing.
So, yeah, okay, thank you everyone. If you have any other questions, just let us know. Sir will be in contact with you. So let's forward with, yes, I'm audible now. Okay. So with our practical approach, you can see आप लोग practical approach के बिना अग्निकर्म या विद्याकर्म सीख नहीं पाओगे. So that's why Dr. CSV Ayurveda comes with us and they're providing some stuff which will be helpful for you in your upcoming days for your practice. So in collaboration with Zenith Ayurveda and Ayush Gurukulam, yeah, sure, Ravi. We will have more lectures on it. We are bringing some शालाका for use जो आपको वो लोग बहुत ही मिनिमल प्राइस में आपको प्रोवाइड करा रहे हैं, which is trusted by 500 plus Ayurvedic doctors and students associated with national institute like ITRA, NIA, and supplying 80 plus Ayurveda colleges and private hospitals. These are some salakas kit they are providing to you in just minimal price like 749 rupees only. जिसमें आपको ताम्र कॉस्मेटिक शलाका, सुवर्ण वर्ण शलाका और पृथ्वी का शलाका आपको मिल जाएगी. ये 3 किट उन्होंने हम लोगों को प्रोवाइड किया है जो कि बहुत ही मिनिमल कॉस्ट में है. यदि मार्केट प्राइस आप इससे कंपेयर करोगे विच इज टू हाई. And if you want to buy this shalaka, it is not compulsory for you guys. If you want to buy this, so please fill the form given in the chat box and please support them and support Ayurveda. Yeah, thank you. I have also shared some attendance sheets. Please fill that sheet as well. Yes, you can on your microphone now.
Madam,
Attendance
what's
sheet
the
complete.
price of that Suvarna Shalaka?
Sorry.
What is the price of Suvarna Shalaka, madam? And please tell the dimensions also.
Right. These all things are provided in the sheet. So let's not discuss here. You just check the catalog and form. Everything will be provided in the form itself. Right.
Mm-hmm.
Sharing the
Right.
form, just give me some minute. Right.
Yeah.
Uh, so last part of the session that is left. So let's proceed with that. Uh, sir, do you wanna say something? Okay. So let's proceed with the last part of the session. And I request everyone to please fill the form.
फॉर्म कहाँ है मैडम?
फॉर्म फिल कर दिया चैट बॉक्स में. So yeah. Again, if you have any questions, just let us know. Sir will resolve all the questions later by. Another thing, thank you everyone for joining the session. And we have also some collaborative partners, and thank you all the digital partners and doctors who have joined this session. And I hope this session is helpful for everyone. And if you wanna a suggestion from us, so let us know आपको कौन सा सेशन चाहिए और यदि आपको किसी पर्टिकुलर वेबसाइट के सेशंस चाहिए तो आप उनको भी हमें सजेस्ट कर सकते हो. एंड थैंक यू सो मच. थैंक यू एवरीवन.
Ma'am, one last question. Hello.
Yes, please.
In that, whatever in Samhita they explained about Siddharthana Sthana, that we can consider for Viddha Karma and Agnikarma.
Sorry.
Whatever in Samhitas, Siddharthana Sthana, whatever they explained, that we can consider for Viddha Karma and Agnikarma.
Yeah, we can consider it.
Okay, thank you so much, sir. It is very helpful.
Thank you.
Thank you.
Any more questions?
Hello, sir. Good evening, sir.
Yeah, good evening.
Sir, it was a very informative session, sir. Sir, I have one doubt. I have seen so many Agnikarma specialists practicing on hernia. They'll do Agnikarma over the Angushta Upari. That is Pada Angushta Upari and Angushta Madhya.
Yeah.
So how it will resolve the anatomical defect?
What happens in this hernia is the internal organs or the which are structures that have come outside, which are exposed outside, that is due to the weakness of the muscles, right?
Yes, sir.
Yeah. So what happens is it will be helping to strong the muscle or the area. So we'll be doing Ardha Chandra Akara, this Agnikarma.
Yes, sir. Yes, sir.
Above the inguinal region.
But they will do Agnikarma over the Pada Angushta, right, sir?
Yeah, even that we can do, and even in this one inguinal region also.
Okay, sir. Thank you, sir. Thank you.
Yeah.
So let's start with the vote of thanks. If everything is fine, shall I?
It was my pleasure, and thank you so much for all the participants for listening patiently. And also thank you so much for the Zenith Ayurveda and Ayush Gurukulam and the team, Dr. Syed, Dr. Deepali, Dr. Kalpesh. Thank you so much for the opportunities. I think the session was helpful for everyone. Though
Yes.
there was lack of time, we couldn't explain it completely. Though it was just a basic, I think. Okay. Thank you once again.
So, as we come to the conclusion of this enlightenment session, it is honor to deliver the vote of thanks. Let us begin by showing to the Guru of Ayurveda knowledge, Lord Brahma, who shared this wisdom with us, and Lord Dhanvantari, through whom this knowledge contributes to flow into our life. We express our deepest gratitude for this timeless wisdom. A very special thank you to Dr. Ashwin, who has so beautifully illuminated the complex topic for us. We are confident that insights shared today will help us to dive deeper into understanding and practicing Ayurveda with clarity. Our heartfelt gratitude goes to our sponsors, Dr. CSV Ayurveda, for supporting this initiative and helping us address noble cause to the Ayurveda. A big thank you to Dr. Nizam, who has worked tirelessly at every level to make this event possible, ensuring smooth coordination throughout. We also extend our thankful to Dr. Kalpesh, whose creative contribution had added a unique dimensions to this program because knowledge becomes impactful when blended with creativity. Our sincere appreciation to Dr. Shipriya for being an ever-present volunteer and constant support to this initiative. We also acknowledge our digital partner whom have been the true backbone of this event and your support helps Ayurveda reach thousands of learners and practitioners worldwide. So we encourage everyone to follow and support them because together we can amplify the voice of Ayurveda. So our digital partners are Innovative Ayurveda, Ayur Suraksha, Ayurveda Media, Kashyap Ayurveda, Aloveda, MV Hubali, Just GMC Things, DM Ayu Kingdom, BMS Medicos, Professional Vaidyas, App Doctors, Apathy Ayurveda, Pranav Ayurveda, Ayu Nirvana, BMS Vaidya, BMS Ayurveda Vigyan, Rishi Satyaha, Avishkar Ayurveda, Ayurveda Darpan, BMS Ayurveda, BMS Gallery, BMS Influencer Hub, Ayurshala, BMS Katta, Agastya AMV, and Sai Pratham Neurocare. Thank you for all your incredible contribution to this mission. And last but not least, our deepest thank you to each and every participant who joined us today. Your presence, enthusiasm, and support are what makes the Ayush Gurukulam and Zenith Ayurveda a growing family of learners and healers. Thank you so much.
Thank you.